Vaginal dryness can lead to uncomfortable symptoms like burning, itching, abnormal vaginal discharge, and pain during intercourse. Estrogen is needed to keep tissues lubricated and healthy, and decrease in estrogen during the perimenopause and menopause leads to these symptoms. These symptoms may lead to less satisfying sex and also avoidance of sexual intimacy. A lot of women actually shy away from opening up about these issues. But please talk about this because there are several treatments available and these symptoms can be relieved through effective management. So, what can be done? Prior to starting treatment for vaginal dryness and symptoms associated with this, other certain conditions should be excluded in particular, especially if you have any postcoital bleeding, that is bleeding after intercourse. This will need to be evaluated to rule out any other cause which may be pre-malignant or malignant conditions. Or if there are any urinary tract symptoms like burning or frequency of urination, then we need to rule out that cause. There might be other symptoms of vaginitis which also will have to be evaluated for any infectious or non-infectious causes. First line of treatment usually includes non-hormonal vaginal moisturizers and lubricants. Symptoms of vaginal dryness can be managed by the regular use of vaginal moisturizing agents and supplemental use of other vaginal lubricants for sexual intercourse. These agents actually improve the discomfort during intercourse and also increase vaginal moisture. But they don't usually reverse the atrophic vaginal changes, but they are useful with the symptoms, especially for mild symptoms. Now, some women may have persistent symptoms and may require additional hormonal medications or other treatments. Sometimes you may have to try various products till you find the one that meets your needs and the one that you are comfortable with and suits you the best. The only contraindications to these products are if you develop any sort of allergy to any particular cream or any product. Vaginal moisturizers are actually intended for use routinely. They are long lasting and so typically can be used 2 or 3 days per week and not only during sexual activity. Whereas lubricants are used only at the time of sexual activity. Vaginal moisturizers and lubricant therapy appear to be effective in many women. Now, what happens if the symptoms are persistent? In that case, vaginal estrogen therapy is a common second line of treatment that is suggested. There are some concerns that women have when these treatment options are usually suggested. Some of them are like, one of the questions that are asked is, can I still have sex? Yes, you can. Regular sexual activity can help to keep the tissues in your vagina more elastic. But if sexual intercourse is uncomfortable or painful, then you must consult your healthcare provider. Should I clean the area with any antiseptic solutions? Of course, it is important to practice good hygiene for the vagina and vulva, but avoid using scented soaps or lotions in your genital area. These can cause or increase the dryness and irritation. Instead, regular cleansing with plain water is all that is required. Will these medications that I use be absorbed by my partner? Exposure of these creams by the male partner is rarely clinically significant. So most important thing to understand is if you have any such issues or symptoms, please consult your healthcare provider because treatment options are multiple and beneficial.